This is a report about children and young people's mental health. I'm Sarah Wollaston, I chair the Health Select Committee, and we're the body that is there to hold the government and all those health regulators and health bodies to account on behalf of the public. I think one of the first things that came out during our inquiry was just how out of date our information is. It's 2004 since we last had the prevalence survey of what's happening to children and young people's mental health. And since then, there have been many new challenges that have arisen. Previous data didn't even take account of issues like cyberbullying and all the pressures that people face from the online world.
It makes intimidation more alarming and more chronic. You know, you can be teased in the playground and it's gone with the wind. But if you've got your photograph on Facebook, then it stays there forever. So I think the medium is not the cause, but it certainly facilitates different ways of harming each other, of abusing each other. That's what young children do. And some of these girls have been bullied into the state of despair because their attachments at home are not strong enough. So they rely on their friendships to be a family for them. And when that family crashes, they feel they haven't got any.
Clearly, it's unacceptable that young people have to travel such long distances from home if they need to be admitted to mental health beds. It's also unacceptable that those beds are often in the wrong place, in the sense that you have young people being admitted to adult wards, and in the worst cases we're even seeing in 2012-13 that 263 children and young people were actually taken to a police cell because they were waiting for a mental health assessment. Clearly that would be unacceptable if it was somebody suffering from a physical condition. Equally unacceptable in our view that that should be happening because a young person has a mental health problem.
Recently, for example, we had a 15-year-old girl who came from Birmingham. It was a new presentation and she had to go to Newcastle for a bed, whilst at the same time we had someone from Newcastle being admitted to one of our beds. So the lack of coordination is completely outrageous, really.
The shortage of bed spaces is clearly very important, but what emerged during the course of our inquiry was how much more important it is to invest in early access to mental health services for young people through early intervention.
The weekly cost of a bed in a Tier 4 placement, we could be talking somewhere between £5,000 and £7,000 a week. You know, £25,000 plus a month. You can provide a lot of bespoke services in the community with a lot less funding than that.
What we'd like to see is a focus on early intervention alongside making sure that the beds are available in the right place when they're absolutely necessary. We'd like to make sure that the fragmentation of commissioning arrangements is sorted out. And we'd also like to make sure that when young people are in hospital, that they have access to good quality education. And finally, let's make sure we end for good the scandal of children and young people being taken to police cells when they have a mental health crisis.